Our Osteofit classes at Eastern Sports and Spinal Care are designed to help reduce the risk of fracture due to low bone mass. 2/3 of Australians suffer from osteoporosis or osteopenia, and by 2022 it is estimated there will be an osteoporotic fracture in Australia every 3 minutes. Exercise plays an important role in strengthening bones and reducing fracture risk. In this video, we will tell you more about osteoporosis and the benefits of our Osteofit program at Eastern Sports and Spinal Care. I'm here now with Tenille Schammer to talk about our Osteofit classes. So Tenille, why do we care so much about bone health?
Around 2/3 of Australians have low bone mass, so either osteopenia or osteoporosis. These conditions make our bones weaker and then therefore they fracture more easily. They're predicting by 2022 that there'll be 500 fractures a day, which is a fracture every 3 minutes. So that's a pretty shocking statistic, and that's an awful lot of broken bones and a lot of pain and disability, and also a huge strain on our healthcare system.
So how would someone know that they have low bone mass?
So osteoporosis is a silent condition, so there's no pain. So someone wouldn't know that they have osteoporosis unless they've had a bone density scan or if they've had a suspicious fracture. You can speak with your GP to discuss whether having a bone density scan would be worth considering for you.
And who is at risk of having low bone mass?
Your bone density peaks in your early to mid 20s, and then for women it drops off quite rapidly around menopause and slows in their 70s. For men it diminishes at a much slower rate, but it is important to remember that 1/3 of osteoporosis sufferers are men. So there are some other risk factors to remember. If your mother, father, aunt, uncle or sibling has had osteoporosis, that does put you at a greater risk. Having low dietary calcium, low vitamin D levels, some medications and other medical conditions can also put you at a higher risk.
What can we do to promote our bone health?
Eating a good calcium-rich diet, maintaining good vitamin D levels, exercise. Some medications are used sometimes to treat osteoporosis, and reducing your alcohol consumption and smoking.
Why is exercise important for our bone health?
Our bones are continually remodeling and laying down new bone, and this process is called osteogenesis, and mechanical loading of our bones stimulates this process, particularly a multiple of 4.2 times our body weight will stimulate this process. So some activities are better than others at doing this. High impact and changing direction, loading our bones in different ways in sports such as gymnastics, football, figure skating. In those athletes, they have found that they have a superior bone mass to other activities that are lower impact. So conversely, swimming, cycling, walking don't have a positive impact on our bone health.
With that in mind, what exercise should we be doing to promote our bone health?
Recent research from Griffith University has shown that high intensity resistance and impact training has been effective in improving bone health and is safe for those with low bone mass when undertaken in small groups and under appropriate supervision. So our Osteofit classes here are based on the Griffith University research, and our classes are an hour, and preferably we would like people to do them 2 times a week because that's what the research was showing. So our classes include impact training where we're stomping, stepping, jumping, trying to aim for that a multiple of 4.2 times our body weight. Strength training at 80 to 85% effort where we're moving across large joints, and we also include balance training in our program, as this has been shown to reduce fracture risk. So the rate of perceived exertion is hard. We change the activities to meet individual needs as required, and the class is great for heart health too.
And who do you think would be suitable for this class?
Well, you're never too young to start, but I do think that it's most important for perimenopausal women, but also men that have known risk factors, as we discussed earlier. So there are other options for management, and we can direct those people towards those other options if we do not feel that they're appropriate for this class.
And how do you join an Osteofit class at Eastern Sports and Spinal Care?
So to join our Osteofit class, if you can give us a call on 8331 0606 and organise to have an initial assessment with either Louise or myself. And if you would like and you have any further questions and would like to talk to us prior to that appointment, we'd be more than happy to chat to you and answer any questions that you have.